Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome back to the Low Carb MD. Troy, I got too many podcasts. Let me start over.
This is the original, Brian.
I want to do both, actually.
This is the original, man.
I'm going to get you on my other podcast, too. Okay, Jack, we'll start here. How's that? Hello and welcome back to the Low Carb MD podcast. Tro, good to see you, man.
I'm so happy to be here. I'm so excited. This couple that I met at the Keto Symposium in New York City, and I got to be honest with you, I was like, immediately, come on, let's get you on. Let's get your message out there. And then I'm talking to Brian. He's like, oh, yeah, Doug mentioned them to me. And I'm so excited for this. I've been looking forward to this interview.
We are so excited. We loved your talk, Tro.
Yeah, let's give you guys a proper interview. This is Brad and Maggie Jones. Okay, Brad and Maggie Jones from CanceRevolution. Okay, and if you can see it, if you're watching on YouTube, most of our people are listeners, so it's CanceRevolution, 1R. Okay, if you're looking up CanceRevolution, and they actually Maggie's personal story was so moving, and the stories they have gathered for the documentary was so powerful. I mean, the minute I was done, I walked down and I was like, hey, I was basically, pulling on Brad's shirt and like, hey, listen to me, I got to get you on, and we got to get you on, and so it was nice to connect with you guys, and I know Natalie kind of made it all happen that we're here. So I'm just so happy to be here, and Brian, I know, is more excited than I am.
I mean, there's like a lot of people have, we're going through hard times in the world, and a lot of people don't believe in miracles, and so your story is a miracle, and I think I would just love to hear just from the beginning, like when you got diagnosed, what happened, what you were thinking at the time, and so you two are a team. You get tag team, and whoever wants to start answering. This is a huge deal for a lot of people. It's the scariest diagnosis you can get.
It's coming on 1 in 2 people in America are going to be diagnosed with cancer in their lifetime. And for me, it happened 1 month after we moved to Hong Kong. We'd never been to Asia before. And the same month as my 40th birthday. And when I was diagnosed, it was terminal. It was stage 4 in my lungs that had spread to dozens of lymph nodes in my neck, chest, and abdomen, my liver, but the biggest concern were the 4 tumors in my brain and 2 in my eye. And 1 year later, thanks to having discovered some of the metabolic therapies that this team talks about, I was cancer-free. And I wasn't supposed to see my 41st birthday, but I just turned 44 and still doing amazingly well. The only concern I have are in my brain. I had traditional radiation therapy, and it did result in brain radiation necrosis in my brain. So I have a little bit of this aphasia you might hear, but small price to pay. And what's so amazing is that, the treatments that I used can be combined with conventional treatment, and that's how I did it. Even though there are some people who don't even have the option of conventional treatment who have used these and found the same amazing results. And so for our documentary, when we decided we have to share this information, this peer-reviewed, published, incredible life-saving information, we realized it's not just my story. There are hundreds and hundreds of people out there. More and more of them are being case studies or part of pilot trials. And this is becoming a real thing. It's just really hard to get the word out because there's no money behind it. Yeah. So many of the metabolic therapies that we talk about in the docuseries and that I use are things like fasting, a ketogenic diet, off-label drugs. And there's just no pharmaceutical dollars to push that and market it and let doctors know and put those terrifying commercials with all those disclaimers on TV. So we're hoping to do that with less terror.
Yeah, and it's such a hard thing. And then going back, like what were you, when you're a healthy 40-year-old, then all of a sudden what kind of symptoms were you having? Were you getting headaches? Were visual changes? What kind of things that brought you to medical attention to start getting worked up?
The thing is, I wasn't healthy. I thought I was. I was eating what I thought was the standard American diet for health. I had a healthy food blog because it was all whole grains and lean proteins and, non-fat dairy and things like that. It's like just like the government tells me. But I was about 50 pounds overweight, maybe a little bit more. I definitely had a deep alcohol enthusiasm. And a very stressful job that would send me home to, instead of exercising, drinking a couple bottles of wine every night. So I had symptoms for a long time. It was a year before I was diagnosed that I had just a terrible cough that was dismissed. I actually asked the gal at urgent care, she would give me a chest x-ray, and she kind of rolled her eyes at me. She gave me something to suppress the cough, and it went away. And then a year later, I started getting a lot of pressure in my neck, which I know now is the tumors. But we were preparing for this move to Hong Kong, and I thought I was just getting fat because I was at that time. And there were other symptoms with like having some difficulty understanding things while we were preparing to move to Hong Kong. I've always been really good at languages, and I just could not grasp the simple languages. But the final thing that finally got me to a doctor was when I started to go blind. And I told Brad, what did she say?
Well, yeah, I mean, she doesn't share these kind of, she's a trooper, right? So, I mean, the whole time, like, all this is happening, you're probably like, Brad, why didn't you do something? She wasn't telling me that this stuff was going on. So literally, like, one day she's like, I've been having trouble seeing out of my right eye for like about 2 weeks. And I was like, 2 weeks? So I thought she had like a disconnected
a detached retina.
A detached retina, right? And I was like, hey, we got to get that looked at like ASAP. So that day when she told me, it was a Sunday, we went to the hospital, and they checked us into the hospital and made us stay overnight, and we got the diagnosis of stage 4 cancer. But yeah, it was like she says, there was a lot of symptoms, but it just didn't add up to cancer. You just don't realize what it is.
I was healthy. I was non-smoking. You would never think, although we know now that 10% of lung cancer diagnoses are non-smokers, mostly women my age, just as more and more of what I think are the health, toxicity in our environment. I could talk about that forever.
The big miracle, it wasn't Brad. It's usually us guys who go, oh yeah, I couldn't see out of my left eye and I can't walk, but I thought it was just migraines or something. It's usually us guys and our wife saves our life. So this is an opposite story, Huntro.
Yeah,
we went to
a little bit. I'm just curious. So it's just one of the things I hear, and I just want to confirm. You kind of mentioned like the modern medical, the urgent care that kind of sneered at you. That, it just sounds like, you asked for a chest X-ray, didn't get one. It sounds like to some degree there's like this apathy that you're sensing from modern medicine. Did I get it wrong, or am I adding something there that's not there?
No, that's so true. And I think what Brad and I have discovered in this journey is the apathy isn't just for getting diagnoses. It's really for treating cancer in a lot of times in the standard medical system. We commented at the very beginning, and I have one of the best, most prestigious hospitals in Hong Kong and in the US, and they just seemed to follow a flowchart. Like, I'm very lucky that I had a genetic mutation, as most women my age who are diagnosed with lung cancer do. And it meant that I had some opportunities, but if I didn't have that, it's like go straight into platinum chemotherapy. I had that, so I got to do some targeted chemotherapy, but it was really just following this checklist, and they had no understanding of the things that I wanted to try, like keto, like off-label drugs, like fasting.
Yeah.
And I'm still 4 years later, when my conventional oncologist in Seattle is like, I have no idea why you're alive, and I feel like I'm failing him every appointments because I haven't died yet. He still won't support these treatments that I'm doing. And there are so many oncologists who do, and it's incredible. And nobody goes into medicine wanting to harm people. They all want to help. But this system that we have doesn't seem to help so much.
Yeah.
It's interesting that you say China, because I've looked into some of the kind of lung cancer data that's not related to smoking, because I think that's the biggest one. And I recall, I think it was Tucker Goodrich, an enthusiast of kind of the seed oil and looking into seed oils and the health effects. It was actually a study he sent to me, a meta-analysis that showed that one of the leading causes in China, because that's, you mentioned being in China or Hong Kong, is seed oils, is being exposed to the cooking oils from fumes.
The fumes.
Like the fumes of it have such a, and we take that for granted, that this high temperature cooking with these oils is, it's not good for us.
Yeah.
Where did you guys know about this? That's amazing. How did you guys find out about this?
Research, reading PubMed, listening to people like Tucker Goodrich, but it's just, to me, it's obvious. I mean, I was cooking with canola oil and vegetable oil all the time because that's what the government recommends and says is heart healthy. But once you look into the actual data and the studies, it's so obviously not. And I don't think that's the prime cause of my cancer or anyone else's cancer. It's combined with things like too much sugar. Definitely stress is a big player, but it's not helping anyone.
Yeah.
And alcohol wasn't helping in this situation, right?
And for the record, I was so relieved to find out I'm not an alcoholic. But as soon as I decided to quit, it was fine. But I was never quite sure.
Yeah, I actually have a good story regarding we were talking about, the medical care kind of not really doing what you expect it to do. You guys might be familiar with, Thomas Seyfried's work, and he did a presentation that we were able to see on glioblastomas and how if you get treated with brain radiation, which is what Maggie had, very frequently people will develop the brain necrosis. And then what happens is that when you do another PET scan of the brain, that necrosis looks like cancer. It is almost indistinguishable in a scan.
It is indistinguishable in an MRI.
It is indistinguishable. Okay. So this happened to Maggie. But the doctor looked at the scan, said it was cancer, was like, we got to get you into more radiotherapy like ASAP. And we are so lucky that we saw this presentation from Dr. Seyfried, because we fought back. I had to tell the doctor, no, we are not doing, together, it was a co-effort. But we're not doing this. We went and we had to get a specialist for her. He did what was that kind of scan? Do you remember?
It's a spectroscopy and perfusion MRI. And this isn't even an exact way to differentiate, but it really is helpful. The only way to differentiate would be with a biopsy.
Yeah, so we got the specialist scan. The guy confirmed that it was the necrosis and not cancer. We went back to her primary oncologist, and we thought he was going to be like, oh, that's great, I'm so glad, and he was like,
I'm so sorry that I almost killed you.
Yeah, and then what he said,
he's like, well, I usually work with more people.
Yeah, just
wait, what? I usually work with more. So I want to pause here for a second, and I know everybody complains that we interrupt. So I apologize to the listener for interrupting, because I think this point is worth bearing. We're not God's doctors. We are not God. We do not know everything. Our responsibility is to be curious, look things up as best we can and go help the people in front of us.
Yeah.
Right. And here you are, and just, I'm going to think out loud here with Brian, a PET scan wouldn't be able to differentiate because the brain is so it's so glucose avid. So a PET scan wouldn't work. MRI won't work. And you have to get this esoteric test. And even then it kind of doesn't work. So you went to the best of the best, and they couldn't really guide and or help you.
And then they look at you. They look at you like you're crazy because you're saying, look, there's a scar tissue I'm not going to do. And there's like, look, I'm the expert here. Like, shut up and follow orders.
And it's like, I'm the one who's had 4 tumors. I know what brain cancer feels like. Like, tell me about your experience with all the tumors that you've had compared to after. Like, just not giving enough respect to the person who's actually going through it and whose body actually feels it really shocks me.
So what was your, Maggie, what was your primary diagnosis? Was it lung cancer or was it glioblastoma?
No,
It
it's
started
lung
lung.
cancer spread to the brain, which
Wow.
gives me a 6 to 8 month median survival. And so that was how I was not supposed to, well, maybe I would make it to 41 because I was relatively healthy otherwise and all that. And again, for the record, 44, feeling great, just got back from a 6-week solo trip to Bali where I got my yoga teacher certification. I have a great, wonderful life that I never would have had if I just followed blindly the standard of care, that spreadsheet that doctors have. So many, not all.
And Brad, let me step back to you just for a second. So you take your wife in for a retina problem, and you find out she has metastatic cancer, stage 4. Like, what goes to your mind? What's your, like? Do you think, oh, it's over? Like, what was your that day when you find this out? Like, this is horrible stuff.
I was really just overwhelmed with sadness. That's about. There wasn't few thoughts of the future at all. Just I mean, there was you start processing a loss almost, like when you get that kind of a diagnosis. And so, I mean, I did try, and I think I did a pretty good job of hiding my sadness from Maggie. But I mean, I was breaking down and crying like all over the place. I mean, we were in Hong Kong without a car, and so I'd get on the subway and I would just start sobbing, by myself. It's just it's just when I was losing the love of my life, I thought so. But yeah, luckily she is tenacious and did some research. Excuse me, we got a puppy here, and did some research, and yeah, I'm just so thankful. Yeah.
So I mean, you get a diagnosis like this, and I mean, it sounds like you didn't quite have, I mean, maybe to some extent you had a challenging spirit, but now the way you talk about the nutrition and the problems of nutrition, now the way you talk about medicine, the problems of medicine. So is this something you picked up? Did you have like this kind of questioning? Who had the fight in them, and when did that fight really come out,
I am very lucky that I've always been kind of a woman who disregards authority.
Questions.
Yes. So the very first week, almost the first week, I wanted to be a good patient. I wanted to die well. I wanted to make Brad and my doctors proud of me. And I was kind of resigning myself to that. So I was diagnosed on a Tuesday. That Friday, Brad took me for a weekend. I started reading some books that mentioned fasting. I started my first 24-hour fast that Sunday. And I was like, you know what? There's less than a 1% chance of surviving the kind of cancer that I have. It actually rounds to 0. But if one person did it, I can do it. And I always like to think that 1,000 is 0% of a million. And that's me. And there's going to be more and more of me out there. And I really do think that a lot of those people who are succumbing because they don't have hope and they don't realize the hope that's coming. And I don't want them to have to wait for it. I want them to have that hope now.
Oh my goodness. Hey, look, I get goosebumps because Tro knows I talk about hope all the time. I'm in the unwin camp that we talk about hope, because one of the worst things we could do is take away hope, say, look, there's nothing we do. You have stage 4 metastatic cancer, we're going to call in hospice. And that these things, I'll tell you, and Tro, we could talk a little bit about the medical system. I want to tell 2 quick stories, but one was someone who's become a really good friend of mine. His sister-in-law worked for me, and she said, please, can you look at this MRI of this guy's brain? And so basically what happened is they found a spot in his brain. He was having some syncope, like passing out, having some weird symptoms. And I'm looking at his brain scan. I go, well, it doesn't make sense. That shouldn't be causing the symptoms he's having. So he was in a neurosurgeon's office, and they said, look, if you leave here and you die, it's on you, it's not us. You need to get this surgery today. You cannot leave the office. And I said, well, let me get a second opinion. So I sent him to my neurosurgeon. He looked and he's like, this has nothing to do with, that's probably been there forever. He's never had a scan before. And so they were going to cut into this guy's brain for something that was totally unrelated. He had subclavian steel was the problem. He had a different, it was totally a different body part. His heart had a problem, not his brain. So, and another patient of mine who has a history of breast cancer, she ended up having a bypass surgery, and they did a PET scan follow-up for the breast cancer, and they go, oh, you have metastatic disease all through your chest. Well, it was just inflammation from the surgery she just had. No one asked her the history.
Wow.
So they told her, like, get your affairs in order, it's over. And she had nothing wrong with her. She had no cancer at all. But these kind of things, the human toll that it has on you, that, instead of saying, let's do a clinical correlation, look at all the data and understand what we're doing and not just look at a study.
And you're totally right. I mean, this idea, the mental aspect of dealing with this kind of a diagnosis is huge, right? I mean, I feel like that played a giant role in, we stayed positive. We tried to, just, not think about, like, we didn't put any dates on the calendar. It was just like.
Well, I really wanted to see Game of Thrones, and I wasn't supposed to make it to the finale. And that ended up not being important.
We got to call up HBO now. That's what we got to do. I heard we have a connect in to HBO.
I live for this.
Yeah. And now there's a sequel. So
hope
I want to
so
come back.
important. Yeah.
I want to come back to one thing here because, and Brian has talked about this. Brian's the king of hope. But there's also a fight here, which I want to bring out a little bit. Because you said, I'm a quote unquote woman who never, who always question authority, right? And so, because most people in a situation like this, and I've seen it, have this phenomenon of learned helplessness. Like, I'm just going to do what I'm told, and I'm not going to advocate for myself. And this is what the doctor says, right? And yet you had none of that. So at what point, what happens? Because this fight doesn't start. I mean, very clearly now you've highlighted enemies, metabolic enemies that you now have a clear understanding about, conventional medical enemies that you very clearly understand and know, and you're articulating those, very clearly. But I don't think you always knew these as enemies. So can you guide us from, you get this terrible diagnosis and it's week 1 and you're fasting, to wait a second, I've been screwed, and they've been screwing me and they're screwing millions of other people. You said 0% of a million is 1,000 lives. So how does that happen?
Honestly, and this may not be what the audience wants to hear, I just remind myself that nobody goes into medicine wanting to hurt people, and that I pity these doctors who follow these flow charts, who in many cases their hands are tied by the system. I look at, there's doctors like you two who are incredible and are always advocating for your patients, but I can understand how it's difficult for others, and I try to keep that compassion. But at the same time, I do my own coaching and I try to encourage people. Really making this docuseries is the most important thing that we can do to just educate people to be their own advocates. Like, trust your doctor. They can prescribe drugs, great, but tell them what drugs to prescribe. Tell them what's going to help you or what not to prescribe. And then the other thing I want to clear up is I wasn't always 100% all the time hopeful, like, this is it. There are times when I was on the subway in Hong Kong thinking, gosh, I really want to just sit down. And I didn't look like I had cancer. So I would give up my seat to the older person or whatever. But I wish Brad would just feel sorry for me. I wanted people to feel sorry for me because I had this disease. But I was really lucky that I could shake that off and be like, that's stupid. I have a year to live. Let's enjoy this year and let's suck it, everything we could out of the experience of living. And I really feel like it's been that. I'm just enjoying every moment of life.
Yeah, I will. I mean, we've mentioned this before, but one of the things that once Maggie sort of was on this path, and you could tell pretty quickly that she was getting better, but both from some of the conventional treatments and then also the metabolic therapies, both probably were helping her. But I kind of took a tough love approach where I was like, I'm not going to treat you I mean, obviously I would do anything for her, but this idea of like, rolling out the red carpet because she was, dying. We didn't do that. We kind of tried to, keep things normal, I should just say. Yeah.
And his attitude towards me, like knowing that I was going to be healthy, that I was healthy, that helped me so much. I think if I just wallowed in pity, I wouldn't be here today. So thank you.
Yeah, you're welcome.
Yeah, and I see the way you two look at each other, Tro, right? Like you look at that and go, wow, that's just like, it brings tears to my eyes thinking about it. And, I just had the pleasure of interviewing Tro and Rosette too about their marriage and life and all that. And you see, the importance of relationship and supporting each other, and also just not saying, okay, I'm just gonna let you, like Rosette didn't just let Tro go down that road of just being not taking care of himself, and she kind of challenged him to do things, and that's what we need. And then someone to say, hey, I'm not just gonna serve you and let you sit on your butt all the time. You're gonna live your life a little bit and get outside and go enjoy things. It's really important.
Yeah.
Oh, I can't wait to hear that interview.
So Brad, so you see, you see Maggie kind of fighting the system, right? But I'd imagine at some point you're not quite, these concepts of food as medicine, metabolic health, the doctor doesn't know everything. That may be more her angle, which it sounds like she's had that in her, but that may not be yours. Right. From what I remember, I think you worked in kind of the corporate world where stuff like that doesn't fly. So how do you react to her being so questioning, and how, like, when do you flip over like, holy crap, she's right,
Good question.
Yeah, that is an excellent question. Well, I mean, about a month after she started eating a ketogenic diet, I joined her in the diet, right? Is it about?
No, it was like 6 months, but
Oh. It was less than 6 months for sure. Yeah, because I'm lazy. I was just eating whatever you were eating.
An unintentional ketogenic diet.
Yeah, exactly. I was lazy keto for a few months, let's say. Yeah, I guess it's her and her body, so I really trusted her, and I guess
some part of you's got to be like, no, just listen to them, like, right? So like some part of you's got to be like,
I think I was more taking an approach of just as long as you are getting all the information and making an informed decision, then whatever you want to do, I will support you. I believe that is that, do you remember?
Yes, I have always been so grateful to Brad, because above all authority, really, he trusts me. And I get that impression. And I would send him out because I was still working in Hong Kong, and he'd go out scouring the grocery stores for anything organic that he could find, anything, to this crazy list of requirements that I had from the very beginning, from week one. And yeah, you never questioned me. You were always supportive.
Yeah. I was also going to just add that it became pretty easy to, I really wasn't like a switch, but it was easy to trust Maggie when what we're getting from the doctor at the time was a 10-minute consultation. Like, okay, here's your chemo drugs. It wasn't, there's nothing in depth. No, like how is it going? What are you doing? So am I going to trust this doctor that sees her for 10 minutes? I know that they look, I know that doctors look at, patients' charts and things before you come for a visit, but literally, am I going to listen to this doctor that just has a small amount of time to look at her information, or am I going to trust her? And she's like reading like a book a day on and like listening to a podcast. She just immersed herself in this world very quickly, and so yeah, it was not a tough decision, honestly.
And Maggie, what made you go down the road of a ketogenic diet? Looking at that, were you looking at a high fat ketogenic? What was the rabbit hole you went down to get to where you were?
So it started early on with the fasting. And so the first cancer book I read was Chris Carr's Crazy Sexy Cancer. Quick read, just trying to pump myself up. And then the second one, the following day, oh gosh, I can't remember now. It was Tripping Over Truth by Travis Christopherson. And that sent me down the rabbit hole. And from there, we've made friends with Miriam Kalamian, Tom Seyfried, who I really do credit with saving my life. But the research that he did with Angela Poff, with Dom D'Agostino, just absorbing these papers as quickly as I could.
You read Naisha's book, the metabolic, approach to cancer. Yeah.
And all of these just gave me another nuance. And for me, I'm ashamed to say I happen to have a genetic predisposition to being able to eat low protein. So my first year, I was completely plant-based keto, which there are thousands of us, but that's not the right approach for everybody. And I've experimented with higher animal products, fewer. And it's just experimentation now, because after the cancer receded in the first year, I feel so much freedom. I'm not afraid of cancer at all. I'm annoyed by what's happening with the necrosis, but I've had, cancer come back, and I can fast for 7 days, water fast, and it disappears. In my next scans, my tumor markers have been completely normal. It's something that's within my control. And that's what's so important, I think, for people to understand. Even with stage 4, you still have control.
Yeah, this is such a hard topic, Tro, and I'd love to, as a matter of fact, today I'm seeing my wife and I are heading to see our friend he was married to my wife's best friend who died of metastatic breast cancer, right? And, he came to me and said, what do I do? And I'm like, well, you know what, as an adjunct, let's look at a keto diet and see what we can do. And by that time she had stage 4 cancer everywhere. And so it was probably too late, but when she went through chemo and radiation, everything, she came through with flying colors. She had no sickness. The doctor couldn't believe it. It was a miracle to the doctor. And then a good friend of our podcast, got in trouble because he's in a big system. And he said, you should think about a cancer patient came to him instead of eating boost supplements and all this kind of stuff, maybe try a ketogenic diet, a high fat ketogenic diet, and fasting before going through chemo. And he ggets called in and gets fired from his job, because the oncologist, the oncologist complained and said, he's going to kill my patient. Tro, do you know who I'm talking about?
No, I don't know.
So anyways, that's, and to say, gosh, there's just, you follow the guidelines and that's it. Instead of saying, okay, what's working, what's not working, and I think it's such a controversial thing to talk about this. And I think, and the thing we have to preface to people is like, look, follow with your doctors, but look at these as adjunctive therapies at least, and say, okay, I want to get myself, if the sugar's feeding the cancer, I want to starve the cancer as much as possible. And is there a benefit? I think there's so much we don't know, and you may be able to educate Tro and myself on this because I'm not an oncologist, but is there an advantage of having ketones floating around, of being in ketosis, of protecting the healthy cells? Or is it just that you're taking out bad stuff that's causing, that you're feeding the cancer cells, and I would love to hear your take on that and your theories.
Yeah, well, so one of the people that we interviewed in the film, Dr. Longo, he does a great way of putting it, where if you're in ketosis, you're correct, like your normal cells are kind of like shielded a little bit. They kind of like go into like a little bit of a hibernation is even a way to think of it, right? They kind of protect themselves. But cancer cells are still ravenous for glucose. They are still trying to just soak up anything that is in the system. So what ends up happening is that conventional therapies end up being much more effective when you're in ketosis, or if you're fasting, especially. So you can have like a lower dosage a lot of times. So they're starting to experiment now with drugs that were too toxic, right? That would have really, harmed people. But if you can have a lower dosage of it, then, and so that's one of the great things about being in ketosis, is it allows you to your conventional therapies to be more effective. So what else?
Yeah, I was thinking Adrienne Scheck too. Mm-hmm. She's shown in some of her research in brain cancer that just having ketones, even without a ketogenic diet, and this is pretty small studies, is still helpful. And it can do things like reduce the hypoxic environment around a tumor cell. It can reduce angiogenesis.
Reduces angiogenesis. Yeah.
And I mean, in general, just the brain loves ketones. As much as we hear like you're always going to have enough glucose for the brain. You have gluconeogenesis, you're going to be okay. But the brain also loves these ketones. All the cells do. It's really hard for me to see a downside, except it can be difficult for some people. And I never judge those people as long as they have the information on how it can help them in improving quality of life, like you mentioned, in reducing the side effects of conventional treatment, and in so many cases, actually prolonging life. Just know, and then make a decision.
And one of the things, that doctors don't want to do a ketogenic diet is because they're really scared of
cachexia.
Cachexia. So, that's almost right out the gate. You mentioned, ketogenic diet to an oncologist. They're like, oh, no. We got to keep all the weight. Right. And, you guys might know a little bit more about this, but I think that the weight loss, that cachexia, really happens near the very end of a cancer disease. And so if you're, stage 1, 2, 3, I would say go for it. It's like,
there's very clear research that keto can can prevent cachexia, and now there's very small emerging research that it can prevent it, or sorry, reverse it. Aphasia.
Yeah, I mean, it's nutrient dense food, right? So I think the worry is people with a cancer diagnosis who don't have the one mindset you guys do, and two, the access to education and drive, really that drive, right? And you guys were already willing to think outside of the system, but imagine you weren't, right? So people that I've seen with cancer, they just stop eating. They get this terrible diagnosis, and psychologically, they don't have that great kind of mindset that you had, and they stop eating. So there's this fear that, there's kind of like this eating disorder. Well, the flip side is that it's really not true. One, I mean, people usually come back to eating fairly quickly, right? And then the flip side is obesity literally causes cancer, diabetes causes cancer, hyperglycemia causes cancer. So to say that this is bad because of cachexia, I think it's not.
Well,
it's not
yeah, and then you have insulin like growth factor, all these other things that are contributing, right? So it may be an indirect, these high sugar, high insulin, the high, metabolic sickness, mitochondrial damage, all this kind of stuff. And the other thing that Jason Fung and I talked about too was that, when we've all seen it, when someone's dying, they could be completely out of it for weeks, and then they stop eating. And guess what? They go into ketosis, and all of a sudden they go, "Hey, make sure you pay these bills. Make sure you call Uncle Tom." And they become very clear. We've all seen this, and there's a term for it, like the clarity of death or something like that, but they're in ketosis, like radical ketosis. And you go, wow, maybe that's and like Jason was saying, maybe that's our body's last ditch effort to fight this illness, is saying, okay, let's just throw you into ketosis and see if your body can have enough energy to fight back.
And instead, people are force feeding you Ensure.
Exactly right. And soybean oil and all this other garbage, because you're trying to get fat weight on people that's not going to benefit them.
Yeah,
it just prolongs the
IV
process.
of sugar.
2%, at the last statistics I have, 2% of people are underweight. And those are the people who I think need to really consider the pros and cons of fasting. But the rest of us, 5 days of just drinking water, you put that weight right back on afterwards. At least I unfortunately do. Yeah. And the potential healing is so deep.
Dr. Seifried has talked about the benefits. You may know the exact numbers of if you just fasted once a year or something like that, the decrease in cancer rates.
My favorite Seyfried quote on that, he actually posited one time that chemotherapy might be as effective as it is because you don't want to eat afterwards, and it enforces a fast for a couple of days.
Yeah, I was going to say, they'll probably market chemotherapy as a obesity drug soon.
Yeah, and obesity surgeries too. You're fasting for a few days after that too. So, there's a lot of benefits to fasting, because they're saying, oh, they resolve their diabetes before they lose weight. Well, part of it might be this whole fasting thing. Right? Crazy Jason Fung's been talking about for how long?
Yeah.
And he's in our documentary as well, Dr. Fung.
He's in all the documentaries, man. You can't get away with anything without Jason being in it, for sure.
Oh, we thought we were special.
No, we knew it'd be easy to get.
No, he's hard to get. We haven't had him on in a long time, man.
Yeah, I just had a chat with him. He's doing awesome. He's doing really well.
Yeah, he's killing it. He's an awesome guy.
Yeah. Kid's going to college, and so I'm just curious. So at some point you're going through all this, and at what point does the light bulb kick off that we have to document this? We have to find other people. Because I remember, can I share the last scene of the first episode? Can I share that? Can I talk about it, or am I not allowed to talk about it?
Yes, no, please talk about it.
Okay, all right.
Yeah.
So the last scene, at the screening was, one patient talking about a ketogenic diet and how it affected their lives, and fasting and metabolic health. And it slowly pans out to just screens of faces and faces and faces that have all been interviewed, and that testament, to provide testimony to the power of a ketogenic and fasting lifestyle. And it was such a moving moment. So, where did you go from, okay, this is my journey against the system, finding things out, discovering, to we need to put this in a documentary and we need to interview, I don't know how many, hundreds of people, I'm guessing, maybe more? What's that?
It's going to be 100.
Yeah.
And
So
all their stories are on our YouTube, the full, complete story as they show.
Yeah, and I should say to any of your viewers, if you have used a metabolic approach or any kind of ketogenic approach to help with your cancer, whether you became completely cancer-free or not, if you think it has helped you, we would love to talk to you. So please reach out.
But tell them when you had the idea for the documentary.
We just were Maggie made a blog that she was putting this information out there, and it was really helpful. She then tried to do some coaching, some one-on-one coaching, and it just wasn't, we just weren't getting the reach that we wanted to. And the things that we kept hearing from people were that the books were either too hard to digest, or just a lot of information to to take in, when especially if you're either newly diagnosed and not a doctor, or if you're someone who's trying to a caregiver, you're trying to take care of someone. There were people who were like, we need this information to just be easier. And I just said, hey, I used to work in the entertainment industry, and I was like, what if we try and make a documentary about this? And we basically said, hey, if we can get Travis and maybe Dr. Seyfried, then we'll do it. And that Travis was, we had met Travis before, and he was nice enough to do an interview with us. And then I think because of him, Dr. Seyfried said yes. And once we had the two of them, it was sort of like a waterfall, like a bunch of dominoes, I should say. Yeah, that was really the impetus, was just this idea of getting this information out to people in an easily digestible way, right? You can just sit on your couch and just let it come. And
for me, the real turning point, Brad had this idea with the blog and my coaching. The demand was too much for me to do one-on-one. It's very wearing, to talk about cancer all the time. Everybody's convinced they're dying, and to convince them that they're not. But there was one wonderful woman, a nutritionist in Finland, who reached out to me for help with her brother, who was 30 and had just been diagnosed. No, he was about a year into his GBM diagnosis. It was the end stage. And she was a nutritionist, so she knew the power of keto from her own research and was trying to convince him, but she couldn't because the doctors didn't support. So she enlisted my help to try to explain to him how powerful it was, how much it helped me. And he couldn't even come to the phone. He was too tired. We tried to videotape and record, but I'm not a great speaker. And he couldn't be convinced that this was something to even consider or to look more deeply into. It was pizza and beer for him, and celebrating the last month of his life was the direction he chose. And I feel personally like that was a bit of a failure, that we couldn't communicate this information well enough to him. And so if we have Brad's great filmmaking skills, he is quite a wonderful editor, 20-year career there, and we had this great information, then we can make it exciting enough and interesting enough that somebody at any stage of their diagnosis can at least get the information, whether they pick it up or not, and make their own decision.
Yeah.
Yeah, it's so huge. Yeah, that's so huge.
Dedicated to him, Marius Stalin.
Wow. Yeah, and that's so huge, because you're right, because a lot of people aren't gonna read a book. They're not going to pick it up. I have people that can help. They're like, that book's too thick, I'm not going to read it. But I was like, oh my goodness, I could really help you. But to be able to sit down at night and watch that instead of watching reruns of the Family Feud or whatever, stuff that you're going to benefit from, or at least take nuggets here and there, or at least have some hope too. And every time you see a story like that, that's kind of the thing Tro and I were talking about at the beginning with diabetes, is providing that hope. Is you don't just have a chronic progressive disease that we can't do anything, we're just putting band-aids on until you get your amputation. When we can actually help people, and they know that they can go to a Zoom meeting like this and see 50 other people that got better, and then they go, maybe I can do that. But what we're doing in Western medicine now is we just take away all hope and then forget it. You're on hospice and that's it.
Yes. Diabetes revolution coming soon.
Yeah. Yeah.
Really? Oh, I'm excited. Really?
Well,
you'll be in it.
The more I'm around Tro, as a matter of fact, I'll just tell you all a quick side is, one of my patients flew in from Iowa to meet me. He's a pastor, faith-filled guy, comes in, and he ends up he had a kidney stone. They do a CT scan. They go, you have ascites all through your abdomen. We don't know. It's a cancer, but we don't know. He's in with oncology. He's in with all these people, no diagnosis. They get a CT scan. no mass, but tons of fluid in his abdomen for no reason. It wasn't related to the kidney stone. And anyways, he gets another scan, it gets worse. So they go, okay, we're going to tap it and get some fluid so we can make a diagnosis. And they go to do the ultrasound. They go, look, there's no fluid there. He also went on a ketogenic diet and stopped a medicine that's an immunosuppression drug for his psoriasis. And so I was dreading this call I have to do with him because he was going to meet with the oncologist, and he says, oncologist shaking his head like, I've never seen this before. It's all gone. Everything looks normal. We don't see anything. So he's like, do you think it's a ketogenic diet? Do you think it's my prayer? Do you think it's, I'm like, I don't care what it is. I'll take it. If you're not having stuff, right?
Yeah.
All
And the
of the
doctor
above.
goes, yeah, we'll see in a year. And I'm like, let's do it in 3 months just to be safe and to see what's going on. But it's incredible. Like stuff like that. You go, okay, was it the drug? Was it the diet? Was it faith? I don't know, but I'll take it. Right, Tro? What do you say, man?
No, 100%. I think the problem is here, doctors, I think we arrogantly think, I wrote about this on social media. The problem with modern medicine is, it's dismissive towards patients. It's arrogance that medicine can explain everything,
Yes.
right? And it's lack of time because we accept the insurance model. Right. I mean, these are the core reasons why, and then a disbelief of patients, like a disbelief, like, no, that can't be, that's placebo effect, so if you take out these 4 things from medicine, you have good medicine. And Brian, it sounds like, in that case, what did you do? Like, wait a second, we should definitely make sure this person's going to be okay. Let's, maybe it is a combination. Maybe it's one of them. Maybe it's all of them. Maybe it's something else. But let's find out. Let's make sure, right? Versus I'll see you in 12 months,
I love to argue with my conventional oncologist about the placebo effect because I know what works for me. And when I take it to him and he explains, well, none of these have been in placebo randomized trials, blah, blah, blah. And well, first, neither has my conventional medication that you want me to take. But second, who cares? It's working for me. You're arguing that it might just be the placebo. Who cares? A placebo works.
Yeah.
There is a study in Harvard saying placebo will work even if you know it's the placebo. So let's just go with what works.
Yeah.
And also the opposite is true. I know surgeons who they'll ask a patient, do you think this knee surgery is going to help you? And if they say no, they'll say cancel the surgery. Because the
Right.
odds are they're going to have problems afterwards. And that's the power of the brain. Like you having a positive attitude, not going, I'll be the 1%. Other people are looking at it differently and saying, okay, I'm gonna die. So let me just withdraw, lay in bed all day and mope, right? And so you're right, because I was thinking about that too. It's like people say, well, you don't want to give false hope. It's like, I'll take false hope.
Yeah.
I'll take that.
Why? Oh my
If
gosh,
it
you
gives me
might
a
die
hope to keep
hopeful and
going every
happy.
day, right?
Yeah.
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 So,
And
so how long did it take to interview everybody? And I want to be mindful of everybody's time here, but how long did it take to interview everybody? And is CanceRevolution going to be a documentary? I think you mentioned docuseries. Like, what is, what's going to happen with all of these important stories?
Yeah, the interview process, to answer that question, Maggie and I got in our little hatchback car, threw a bunch of gear in it, and we drove around the country for a month, basically. We drove from Seattle to Boston, down to Florida, then across the country through Texas, and then back up to Seattle. And then we took another little side trip down to LA. So,
and Florida and Cincinnati and Toronto.
yeah, we went to Toronto to see Dr. Fung. So, and this was the first 30-day trip was during COVID. So we were, when everybody else was holed up, we just got on the road, and actually it was really speedy. There's nobody on the freeways, so we were going like 85 the whole time. It was great. But that took about a month, and then like a couple other little trips. And what has happened is we thought we were going to make like a 90-minute or a 2-hour sort of documentary. And when we started putting all the pieces together, it was just too much information. It was more than 2 hours. And in addition to like all the information that we wanted to convey, it's also a little heavy, right? To just sit down and watch all at one time. So it actually started really lending itself to being a multi-part series. So we've broken it down. It's going to be 5 episodes, and there's sort of like two aspects to each episode. Is kind of how we put it all together. And one of the things that we did try to stay away from is, if you guys have watched any cancer documentaries, unfortunately, they're always really depressing. I feel like, filmmakers, they want the drama, right? So you open up with somebody in a hospital bed, in an IV tube, and they're drooling, just like the worst vision you can come up with. And as we were doing all this research, we were just like, we didn't want to watch another cancer documentary. We're like, this is just driving us crazy. And so in our documentary, there's none of that. We bypass all that. We assume that the viewer is smart enough to know how terrible cancer can be. We don't need to show it to you. So we took a scientific approach. We talk about all of the history of cancer, the metabolic theory of cancer in particular. We then go into some other, theories about cancer, how you can treat cancer with a metabolic approach. So we talked to Dr. Seyfried. We talked to Paul Davies, who's a physicist. He has a theory on
the
atavistic model,
which Fung, as you know, really included in his book, The Cancer Code. Yeah.
So Fung and Paul Davies, and then our sort of through line through all of this is Travis, because he has sort of being a journalist, he sort of touches on all these things in his book. So so then at the last episode, we do interview all the people that have used the metabolic therapies, to help themselves. And so it's it's just a very, what would you say?
Uplifting.
Uplifting ending. It's just like, we wanted to show it. We couldn't. Even though we could tell you about these things, it's not the same as hearing it from the mouth of people that actually did this. And Tro, I think that's kind of why, it's so powerful, right? It's just, when you just see these people that are, they're like, I had 6 to 8 months and now it's 5 years later. I had 3 or 4 months to live, and, now it's 8 years later. It's, I can tell you this, but it's not the same as you seeing it.
I'm gonna tell you, you already have a fan. I'm gonna watch the whole series. It was.
You made the New Yorker tear up and get choked up.
And my wife was there. Rosette was there, and we're sitting in the. She was just gripped by it, and we were gripped by it. We've had cancer, both sides, lung cancer, in both sides of our family, and so. My wife was so happy to meet you guys, and we, we were just so happy to have you on and support you. And you're joking about Diabetes Revolution, but no, we definitely needed Diabetes Revolution. Okay, so when you're, I already talked to you. I was like, hey, because I saw the video, and the editing's amazing and everything. So you could just tell you're a master at your craft, and. The anime, just everything was so. I'm like, we got to team up, man. Brian, we need to.
I'm excited, seriously. And you look at and as a matter of fact, in Fat Fiction, a lot of, they cut the scene out, but a lot of my patients, their mood, depression, anxiety, panic attacks got better, and they started socializing and living their life, and it was too controversial, so it gets cut out, right? And you look at it like, man, Tro, just this week I've seen people that were just laying in bed waiting to die, and now they're like, they're having a Christmas party with their neighbors and friends, and wow, this is absolutely astounding. It is. It's like, for me, seeing it, I think, oh my goodness, this is crazy to see someone who was just had no life in their eyes, laughing and joking and talking about their new friends and what they're doing at the senior club. Man, this is awesome stuff, and their back doesn't hurt as bad, whatever. But it's so hard because, and in your case, it's really hard because, here's what's going to happen. People are going to see it, and they're going to go, oh, they're just trying to make money. They're just, because people are so jaded these days that they're saying, oh, you're just doing all this stuff to get publicity, and
it's a nonprofit.
Doesn't matter.
Basically,
no, it doesn't matter.
It doesn't matter.
Right?
We have no sponsor.
We have no sponsors. We're not for profit, but
we lost money on this podcast. And people go, oh, they're just doing it to make money.
Yeah, exactly. They're gonna find a way to say, but you know what? I met you guys. You can just see it. There's nothing like, you don't make money fasting. There's no money when you're fasting.
And that's why no one knows.
Yeah,
that's exactly why no one knows.
Yeah, no, we didn't really get into that, but that's, if you're watching this, like, well, how come my doctor's not telling me about it?
It's who's telling him?
Yeah, exactly. There's no pharmaceutical rep coming by being like,
can I add to that? It's Please. The opposite. You want to talk about a story that needs to be told? Coca-Cola literally this week, US Right to Know, I don't know if you were watching my feed, but they literally did Freedom of Information Act, and Coca-Cola has been sponsoring the American College of Sports Medicine, the American Academy of Family Practitioners, okay, and the Royal Society. They have literally been paying them and making sure their name's not on the events, sending sponsors out paid, right? All so we could say, you know, drink their addictive stuff, and you know what, you should exercise, right? That's their message, right?
It's your fault.
So it's your fault. You need to exercise. And by the way, you know, it has nothing to do with our addictive products. So yeah, not only is there nobody paying for fasting, there's people paying to call me and Brian just crazy people. There's people paying to call you crazy, despite having survived and being a amazing statistic and disproving so many people, and in the face of their criticism of you. So you guys are champions, and I'm so happy to call you guys friends. I got to be honest with you.
Thank you.
It's nice to have, you know, honored that you guys joined us. Honestly, honored.
Thank you.
Well,
And
one thing. We'd like to do.
Thomas Drosh. Do you want to mention him?
Oh, no, first this. One thing we'd like to do for you and your listeners is give early access to actually see this episode we've been talking about. So we can't do the official premiere, release it to everybody until we've had the world premiere at Festival, which could be anytime early 2023. But there is a loophole for festivals or private events. So if you guys are up for it, we'd love to have a private event for your listeners with the two of you, maybe us, for a Q&A at the end, but the ability to stream it at your leisure at home for a week that works for you.
We could definitely do something like that. Brian, we could get your practice together, my practice together. We could do like a Saturday night, or I don't know, Friday night, you know, something like that. We could make it happen. We're gonna make it happen.
Okay, great.
Oh, amazing.
Yeah, that would be
Just
awesome.
getting the word out.
That would be awesome. And how do people track you down and find you in the social media, website, that kind of stuff, if they want to support what you're doing?
Yeah, so we've got a good place if you just want to like see video, which is I think our strong point is YouTube. Just put in CanceRevolution, 1R, all one word, and that's our YouTube channel. We also have a website,
CanceRevolution.film.
Yeah.
Hashtag Instagram and Facebook. I'm not so great on those, but also Cancer Revolution Doc. Brad has a Twitter, Cancer Evolves, but we don't do TikTok yet.
Yeah, not on TikTok yet. Yeah, and so on that website is an events page where it lists all the places that you can, you know, where we're going to conferences and where we're having screenings of the film. So, and that'll, if it'll be
You guys
updated.
are coming to Boca, right? You guys are coming to, I think I remember Doug saying
We're
you guys
doing
are coming to
San
Boca.
Diego.
I think we're gonna do the next low car. Well,
Got
actually,
it,
they changed
okay.
the name of it, but I think we're gonna not be able to make it to this one, and we'll do the next one. Yeah.
Got it. Okay.
We actually
perfect.
just talked to Doug and Pam like 2 days ago.
And I'm sure they're gonna have a screening there in San Diego at that point. So that would be awesome.
Yeah, and what we're bumping into, I mean, is to be able to present at medical conferences, it has to be a CME. It has to be a continuing education, and
guess who pays for that?
Yeah, but another problem is like all these people at conferences are like, well, we want you to come and talk, but we really, you know, maybe we can squeeze you in at lunchtime, you know, and we're like, no, we want to be on stage, like just like all your other presenters. So we're going to have to go through this process of getting our presentation CME certified. But the good news is that that's going to happen. So we hopefully you can go to some get a bit broader reach at the conferences we go to.
Yeah,
awesome.
and we're happy to help you. You know, we've done those CMEs. So if you need any help, we're happy to help in that matter.
Oh, thank you so much.
This was awesome, Brian. I'm gonna
Yeah,
let
thank you
close it
both
out.
so much. And really, I mean, especially this time of year, thank you for bringing hope to people and sharing your story. It's hard to do. And so, you know, I'm really looking forward. I haven't seen it yet, so I'm looking forward to checking it out myself.
Must see, Brian. It's a must see. So moving, very moving.
Thank you both so much, not
Yeah.
just for this, but for everything that you do. We're just trying to
I was going to say that.
amplify, think alike.
Yes,
Well-
thank you both so much for everything that you guys do.
No,
Yeah,
thank you. Thanks for joining us. It's really great having you. And Tor, do we have one question from our Patreon people? Let's see.
No, just somebody was.
Oh yeah, would love that.
getting
Just a
on,
comment. Okay, just
premiere.
want to make sure we didn't miss anyone's question there. But
All right.
Wow.
Send
Thank
questions
you.
our way. Put comments. We reply to every comment on YouTube. So if anybody's got any questions for us, please comment away.
All right. Awesome.